Well, two nurses from a clinic in Motherwell in Nelson Mandela Bay sent a raped teenager who was in desperate need of medical attention to a police station. The girl, who apparently walked there, died of an overdose of antibiotics a few hours later when she had a seizure. Health Ombuds Professor Taole Mokoena joins us now. Professor, good evening to you and welcome. What an awful story. Tell us more about what you found out.
Good evening, Imam, and good evening to your co-presenter there, Bobby. We got this referral of this incident of a girl that had been raped and was seeking attention at Motherwell Clinic, where the nurses had deprived her of service from the shadow minister of the DA. Now, the incident happened in September last year, and the girl went to the clinic around about 7 in the morning, but the clinic was closed at that time and was received by a security guard. When the nurses came, when they came at 7:30 in the morning, and two nurses came, and they did not attend to the girl because she was a victim of rape. They said, and later confirmed, that they didn't attend to her because she was a victim of rape, that in rape cases, they're not supposed to examine patients because they might disturb or interfere with the evidence. Now, instead, they sent her to the nearby station, which is about 2 kilometers away. However, they did not arrange any transport for her, and she had to walk to the police station. Now, coming back to the nurses, the action of the nurses themselves, is that regardless of how the injury was occasioned, whether it's rape or car accident or violent injury, the nurses are supposed to examine and assess the patient, and where necessary, give emergency treatment. This they fail to do. And this is against the principle that whatever the patient in front of you, whoever the patient in front of you, you must first assess and see if they need emergency attention before you can refer them to another place. In this case, they send the patient to the police station. However, they should have sent the patient to a higher level of care. But they couldn't have been able to do that without examining the patient first. So we found, therefore, that these nurses were delictual to the degree that they failed to examine and assess the patient, and therefore correctly should have referred the patient to a hospital rather than to the police station.
All right. Well, thank you, Prof, for just outlining the story for us. I'm just trying to think, well, in terms of the law, whether these nurses, and one doesn't know, did you find out whether, these were cases that they deal with on an ongoing basis? Is this perhaps what has been decided between themselves and the local police station? Is this generally how matters, which are matters of this nature, are dealt with? Just to establish whether or not, I mean, of course, the care, the sensitivity, that immediate sense of, let's take care of you, let's at least try and get you safely to to the police station. Just in terms of their concerns around worrying about disturbing, any evidence or not being able to carry out a rape kit. What did you find out with regard to that, in terms of whether in any situation, whether in that clinic or any other clinic around the country, there could be any legitimacy to that claim or to that intention?
Thank you very much for that question. There's no basis for that claim whatsoever. There is standard operating procedure for cases of rape, and like in any other case, the life of the complainant is paramount. So there's no guidance that says that you shouldn't assess the life of the victim. Just to clarify the issue, they need not have done an internal examination. In other words, a vaginal examination to assess whether the child, because this was a child, the child was violated or not. What they should have done is to examine the vital signs. In other words, determine her life if she has any life-threatening change of vital signs.
Yeah. I mean, I think more importantly also, Prof, what you're saying is, here is a vulnerable person, a child, as you described her, in an extraordinarily traumatic situation, going to a place where she assumes she will not only receive refuge and care, but that she would also receive compassion. And it seems as if all of those things also were not there. You know, to take it further, one could have, called the police station and asked them to send a vehicle over, whatever the case may be, to ensure that this child wasn't then left to go and walk those 2 kilometers on her own. Given the gravity of what you've described to us, the oath that nurses do sign in terms of their execution of care, what punishment are they likely to face? What censure are you recommending?
We haven't actually recommended any particular censure. We are referring the matter about the nurse's behavior to the nursing council, which is the jurisdiction authority over them, their practice. You're asking me what censure? There's a whole lot of options for censure. Starting with the most severe would be that they be struck off from nursing role, or they can be suspended for a period, or they can be sent for retraining, or all of those things. And but we did not prescribe what censure should be given to them. It is the matter of nursing council to determine the censure.
Professor Mokoena, and perhaps that is a follow-up we need to do, because we find very often in community clinics, especially those that are outside of the urban centres, similar stories around this kind of behaviour. In the public interest tonight, if anyone is in any community, anywhere, experiencing not only the experience that this young girl had experienced, the responsibility and the expectation of care from anyone is that at least you go there. There should be some, initial triage done, an assessment of other things. Are you bleeding? Is there a broken bone? Is there anything else before you get sent off? So people shouldn't accept just being sent off somewhere else, should they?
That's correct. That's correct, Iban. Your life comes first, and the actual assault is a threat to life. So she should have had, and anybody should have that assessed before they're sent to another place. So they must not accept to be shoved off, as it were, without proper attention. Yes.
Professor Mokoena, sorry, just a quick one before you go. Just on, you obviously know the case, you would have had to interact with the family. How is this girl doing?
She died, unfortunately.
Oh, yes, of course. She died, yes. In fact, that was the follow-up question I was going to ask you. She had been sent off with some antibiotics. We're not sure what the circumstances were, and she passed away. What were you able to establish in that regard?
We don't know where she got the antibiotic, but she took a massive dose, something like 100 times the dose that would have been used for therapeutic reasons if they were prescribed by a health professional. And it is this overdose that actually led to her death.
I mean, this is a double devastation for her family. Not only is she turned away from a place where she should have been taken care of and had refuge, one only can imagine what was going through her emotionally and otherwise. For her to take tablets to that extent, one can only conclude with the intention of ending her life. A double tragedy and trauma. How is the family then, Professor?
The family hasn't found proper closure yet, but it is our recommendation that the Nelson Mandela Bay Health should actually go to her and counsel her properly, either themselves or by a professional such as a psychologist or so. They did talk to her, and the conversation only took 5 minutes, and it was woefully inadequate.
And this is a year later. One would imagine that given what happened, they would do everything that they possibly could to make up for such a great injustice.
Indeed, there should be. In any case, we're saying that if it's never too late to mend, we're saying that they must make every effort. In fact, not every effort. They must succeed to help the family to get closure and counseling.
Thank you for talking to us tonight. It was Health Ombud Professor Taole Mokoena.